This is a picture test in practical anatomy of the upper limb. You may use the video as a revision for the topic or as a self-assessment tool. For the purpose of self-assessment, you may pause the video and spend your own time to read the question and come up with the answer. Then replay the video to confirm your answer by listening to the comments and explanations. Now I will deal with the shoulder region and axilla. Regarding facet A, with which bone it articulates, and what is the type of this joint and its variety. This is a facet on the acromion, where it articulates with the lateral end of the clavicle at the acromioclavicular joint. The acromioclavicular joint is a plain type of synovial joint. The articular surfaces here are covered with fibrocartilage instead of hyaline cartilage, and they are separated by an incomplete wedge of articular disc, intra-articular disc. Identify the tendon A. This is the tendon of the long head of biceps. Here's the tendon of the short head of biceps, but this one is the long head of biceps. The long head is lateral, L4L. At this location, the long head of biceps lies in the intertubercular groove of the humerus, as it leaves from inside the capsule of the shoulder joint. Remember that the long head of biceps arises from the supraglenoid notch within the capsule of the shoulder joint, and it leaves from the inside of the capsule of the shoulder joint underneath the ligament B, which is the transverse humeral ligament. This ligament bridges over the superior end of the intertubercular groove, converting it into a canal for the passage of the tendon of the long head of biceps. Identify the muscle C. What is its action on the trunk? C is pectoralis major muscle, and the muscle as it extends from the clavicle and thoracic wall, sternum and upper six costal cartilages to the humerus. It mainly acts on the shoulder joint, but from a fixed insertion, when the upper limb is fixed, such as by holding a bar, the insertion of the muscle will be fixed and the muscle will act from its origin. And so the muscle can act the other way around on the thoracic wall and the trunk as an accessory muscle of respiration, as it acts on the thoracic wall, and also in climbing. But in climbing, latissimus dorsi muscle is stronger and is better named the climber's muscle. Which muscles form the folds A and B? A is the anterior axillary fold, formed by the lateral border of pectoralis major muscle, and B is the posterior axillary fold, formed by teres major muscle and latissimus dorsi. Identify the nerves A and B. What is the root value of nerve B? In order to identify nerve A, let's try to find the capital M here. And so the lateral limbs of the M are the musculocutaneous and the lateral root of the median nerve. So A is the lateral root of the median nerve. It unites with the medial root of the median nerve to form the median nerve. Nerve B arises from the thoracic wall. To be specific, it is the intercostobrachial nerve. It is the lateral cutaneous branch of the second intercostal nerve from T2. It is not included in the brachial plexus, which is formed by anterior primary rami of C5 to T1. The intercostobrachial nerve supplies the skin of the floor of the axilla. The subsequent nerve is the lateral cutaneous branch of the third intercostal nerve. Remember that the intercostal nerves, as they pass around the thoracic wall, they supply lateral cutaneous branches and anterior cutaneous branches to supply the skin of the thoracic wall, of course, as well as the intercostal muscles supplied by muscular branches. But each of the intercostal nerves has a lateral cutaneous and an anterior cutaneous branch. The lateral cutaneous branch of the second intercostal nerve that supplies the skin of the floor of the axilla is called the intercostobrachial nerve. Intercosto because it arises from intercostal nerve, and brachial because it supplies the floor of the axilla and the uppermost part of the arm. Identify the muscle, what is its nerve supply, and what is its action on the shoulder joint. The muscle is the supraspinatus. As you can see it here, it lies in the supraspinous fossa above the spine of the scapula, and it is supplied by the suprascapular nerve. How can you identify it as a supraspinatus? As you can see here, it arises from the supraspinous fossa of the scapula above the scapular spine, and it is located deep to trapezius muscle. Trapezius has been reflected up here, and supraspinatus tendon, it passes laterally here till it reaches the upper facet on the greater tubercle of the humerus. During this passage, it passes beneath the coracoacromial ligament above the shoulder joint. Supraspinatus is a member of the rotator cuff muscles. Those muscles form a cuff for the shoulder joint and provide stability for the shoulder joint, but this muscle is not a rotator like the other rotator cuff muscles. It is an abductor of the shoulder joint, as it can be expected from the extent of the muscle. It should be remembered here that the chief abductor of the shoulder joint is the central fibers of deltoid muscle. The muscle deltoid here is shown to be dissected from its origin. So deltoid is the main abductor, but a point should be mentioned here about abduction. When the arm is by the side of the body, deltoid contraction is ineffective, since deltoid, in this case, it pulls vertically on the humerus. Therefore, the initial stage of abduction, the first 15 to 20 degrees of abduction, is done by supraspinatus muscle. Deltoid then takes over up to 90 degrees. Shortly after 90 degrees, that's to say, when the arm is raised above the level of the shoulder, the movement requires rotation of the scapula, lateral rotation of the scapula, so that the glenoid fossa faces upwards. This lateral rotation of the scapula is provided by serratus anterior and by the upper and lower fibers of trapezius muscle acting as a couple. Identify the ligaments attached at A and B and name the muscle located in the groove C. This is the inferior surface of the clavicle as indicated by the rough areas at both ends for the attachment of ligaments. Also, it shows a groove at C. This is the groove for the subclavius muscle. The superior surface of the clavicle is smooth in contrast to its rough inferior surface. To differentiate between the medial and lateral ends of the clavicle, the medial end is rounded while the lateral end is flat. The rough area on the inferior surface of the medial end is for the attachment of the costoclavicular ligament between the first rib and its costal cartilage on one side and the clavicle on the other side. The rough area laterally is for the attachment of the conoid and trapezoid ligaments, the two parts of the coracoclavicular ligament. The conoid ligament is an inverted cone whose base is attached to the conoid tubercle on the inferior surface of the clavicle, and the trapezoid ligament is attached to the trapezoid line of the clavicle. And C is the groove for subclavius muscle. Identify the muscles A and B. What is the nerve supply of each, and which of the two muscles is distally attached to the scapula? Muscle A is the subclavius, which is, as you can see here, is a very small muscle that lies almost horizontally. As its name indicates, it lies inferior to the clavicle and extends between the first costochondral junction to be attached to the subclavian groove on the inferior surface of the clavicle. It is supplied by a branch from the upper trunk of the brachial plexus called the nerve to subclavius. The other muscle is pectoralis minor, and this is a small muscle if we compare it to the overlying big muscle here, pectoralis major, that has been reflected away in order to show pectoralis minor. So pectoralis minor is a small triangular muscle. It arises from the third, fourth, and fifth ribs, not costal cartilages. Costal cartilages provide attachment of the overlying pectoralis major, and pectoralis minor is inserted into the coracoid process of the scapula. So it is the muscle that is attached to the scapula. It is attached to the coracoid process of the scapula. The nerve supply of pectoralis minor is from the medial and lateral pectoral nerves. You can see both of them here. The lateral pectoral nerve is above the upper border of pectoralis minor, passing through the clavipectoral fascia to supply both pectoralis minor and major, and the medial pectoral nerve is characteristically passing through pectoralis minor, supplying it, and then reaching the overlying pectoralis major to supply it as well. Which joint is dislocated in this patient? This is a very strong joint that rarely dislocates. It is the sternoclavicular joint. The dislocated medial end of the clavicle forms a prominent tender lump in this patient. Identify the nerves A and B. What is the origin of each from the brachial plexus? Now in this dissection we can see that the two pectoral muscles have been reflected away, pectoralis major and the smaller underlying pectoralis minor muscle. A is the lateral pectoral nerve that arises from the lateral cord of the brachial plexus. The lateral cord of the brachial plexus has three branches: the lateral pectoral nerve, and then this is the remaining part of the lateral cord. It has two other terminal branches, the musculocutaneous and the lateral root of the median nerve. So A is the lateral pectoral nerve, and here it passes through the overlying clavipectoral fascia to supply both pectoralis major and pectoralis minor muscle. B is the medial pectoral nerve, and we can identify it because it arises from the medial cord of the brachial plexus. This is the medial cord of the brachial plexus, continues as two terminal branches: medial root of the median nerve, ulnar nerve here, medial cutaneous nerve of the forearm. Medial cutaneous nerve of the arm is not shown, but the other branch, the fifth branch from the medial cord, is the medial pectoral nerve. And another point of identification here is that it pierces pectoralis minor muscle. It supplies pectoralis minor to reach pectoralis major muscle. Which of the following regions 1 to 4 is the point of the shoulder? The point of the shoulder is the highest palpable point in the shoulder. It is formed by the acromion process. I remember that the medial border of the acromion joins the clavicle. Thus the lateral end of the clavicle is not the most lateral point that can be felt above the shoulder, but it is the acromion. And here 1 is the acromion, so it is the point of the shoulder. Just to remind you about the other bony parts here, 3 is the coracoid process, and 2 is the supraglenoid tubercle, which provides origin for long head of biceps, and 4 is the infraglenoid tubercle, which provides origin for the long head of triceps muscle.